సార్ అంటే ఇప్పుడు పేరెంట్స్లో ఎవరికైనా ఉందనుకోండి వాస్కులర్ ప్రాబ్లం అనేటువంటి అది వాళ్ళ పిల్లలకు కూడా వస్తుంది అన్నట్టు. అంటే ఇప్పుడు మీరు అన్నట్టుగా జెనెటిక్ ప్రాబ్లం అని అన్నారు కదా. సో ఎందుకంటే ఛాన్సెస్ ఈ మధ్య కాలంలో చాలా రెగ్యులర్గా వింటున్నాం సార్, వేరే వేరే డిసీజెస్ జెనెటికల్గా రావడం అనేటువంటిది.
I think genetics is very important for most diseases, including vascular. And I think I consider it so important that we are in the process of establishing a vascular genetic clinic at Care Hospital.
Oh.
It is so important.
Okay.
So, of course, children coming with vascular problems like vascular malformations, children coming with what we call arterial aneurysms, that is, the arteries dilate and we operate on them. Children coming with blocked arteries.
Oh,
Children coming, yes, at young age. In fact, we see at times even neonates, immediately born children can get these problems.
Oh my God.
So, children can have vascular problems. That is one part of genetics. But a lot of adults, for example, they get aneurysms or they get vascular disease at early age or they get aortic dissection where the artery splits. Many of these patients are in their 20s, 30s, 40s.
So what is the major problem for all these things, sir?
So the body has a normal structure. Let's say, for example, an artery. It has a normal structure which God initially designed.
Right.
At some point, some change happened in the gene. So a particular element from that artery is now missing,
Right.
which makes the artery wall weaker. And at any point when sometimes the blood pressure shoots up, the arterial wall can split.
Okay.
Or over a long term, because the artery is weak, it keeps slowly increasing in size. So that is how genetics plays a role.
Okay.
So we are in the process actually now collaborating with a US hospital, establishing that clinic, so whereby we will understand the problem, how it exists in India.
Okay.
And there are obviously some steps we can take to see that these patients, and we screen their relatives to make sure that they are at a lower risk for developing complications because of the bad genes, if I put it that way.
ఓకే సార్, ఇందాక మీరు అంటున్నటువంటి దాంట్లో నాకు చిన్న క్వశ్చన్ వచ్చింది. ఇప్పుడు ఆ వాల్స్ ఏదైతే బ్లడ్ సర్క్యులేట్ అవుతున్నటువంటి పైప్స్ ఏవైతే ఉంటాయో, లేదంటే వీన్స్ అనొచ్చు, లేదంటే మీరు ఇంకొక పదం డాక్టర్ దీంట్లో మీ మెడిసిన్ పరంగా ఇంకోటి వాడతారు మీరు. ఆ వాల్స్ ఎలాంటి సందర్భంలో అసలు ఎందుకు అవి మూతపడి ఉంటాయి సార్? ఇప్పుడు చిన్నపిల్లల్లో కూడా ఆ ఇబ్బంది చూస్తున్నాం అని చెప్పేసి మీరు అన్నారు. అసలు ఎందుకు ఆ బ్లడ్ వాల్స్ అనేటువంటి క్లోజ్ అయి ఉంటాయి?
So valves are not closing. See, the blood from the legs has to go up against gravity.
Correct.
Now, if we try to move anything against gravity, for example, even if we want to, let's say, push water into an overhead tank, we need motor.
Correct.
To push it. So we need some extra strength from below. So legs have what we call a peripheral heart, or heart in the leg, which is the calf muscle and the thigh muscles.
Right.
So when they contract, blood gets pushed up towards the heart. Also, when it is getting pushed up, so when I contract the muscle, it gets pushed up. When I relax, it should come down.
Correct.
But it doesn't come down because there are valves. So valves will prevent the blood from falling back.
Okay.
So when these valves are not working, when they are not properly developed from birth, or normally valves come together like this.
Okay.
So this is the wall. They come together like this and they can open, close.
Okay.
Open, close. But if they move apart because the vein becomes big, they can keep moving, but they always remain open.
Correct.
So that can happen sometimes in pregnancy, where all the tissues become a little weak, the vein becomes big, and the valves just cannot come together. So the blood tends to fall back, and then the pressure in the vein goes up, and they develop what we call varicose veins.
ఓకే సార్, ఇది ఏ జెండర్లో ఎక్కువగా చూస్తున్నటువంటి ప్రాబ్లం? అంటే ఇప్పుడు ప్రెగ్నెన్సీ అనేది స్పెసిఫిక్ టైం, ఓన్లీ ఆ టైంలోనే. సో ఎందుకంటే ఆడవాళ్ళ బాడీ ఆ టైంలో ఎక్కువగా ఎన్లార్జ్ అవుద్ది కాబట్టి ఆ టైంలో ప్రాబ్లమ్స్ వస్తాయి. సో ఏ జెండర్ ఇప్పుడు ఉన్నటువంటి ప్రస్తుత పరిస్థితుల్లో ఏ జెండర్లో ఎక్కువ ప్రాబ్లమ్స్ వస్తున్నాయి ఇలాగా?
So if we talk about varicose veins, typically we see most patients in their 30s and 40s.
Okay.
But we do see patients even in their teens with varicose veins. And we see patients in 60s and 70s who have varicose veins. But common would be 30s, 40s, where we see maximum people.
Right. Which gender? I mean, I'm talking about the gender majorly into.
Actually, males seem to have more.
Oh.
Contrary to what is popular belief that females have. Because females, we see the spider veins, which don't require anything.
Okay.
But the major varicose veins, which may require some treatment, I think I see more male patients than female patients.
So what's the solution for this? Because it sounds some exciting though. I mean, it is always painful to listen this word from coming from you, because you being into the practice and you're understanding the case studies very well, and you've been treating a lot of people every day. Because being a male, so it becomes a concern that why it is happening more to the male.
It is very difficult to say why it happens more to males. I think we are just maybe genetically predisposed. So our valves are not adequately developed, and that is why we develop varicose veins. For females, of course, pregnancy adds a risk factor.
Right.
And then there is something called secondary varicose veins, which occur due to some other underlying problems. For example, deep vein thrombosis. The deep vein gets blocked. So superficial veins become bigger to take the blood. So that may be one reason. Sometimes we have communication between arteries and veins, what we call arteriovenous malformations. Here the pressure in the veins goes up, but these are different set. So secondary varicose veins are a different entity altogether. But if I have a patient with what I call primary varicose veins, there are two ways to treat. After I confirm with the color Doppler or ultrasound that yes, there is a genuine problem, it is not by just looking at the legs. I need to do an ultrasound to confirm that okay, this patient can benefit from a procedure. Then I tell the patient you have two options. One, you can use compression stockings, which will prevent worsening of the problem. So the legs which tend to swell up, or legs which become discolored or pigmented, or there is a chance to form ulcer or develop bleeding, that can be prevented to a large extent by using stockings. And many patients, they say, I don't want a surgical procedure, I'm happy to use stockings lifelong. So if they are sincere and diligent in using stockings lifelong, I have many patients who are doing that. It's a perfectly fine way to treat. Second, patients who say, no, let me get rid of the problem, we can go in for a surgical procedure or endovenous procedure. Nowadays, open surgery is very, very less. Very specific situations, I may offer that. But otherwise, I do either an endovenous laser or radiofrequency or glue or MOCA or similar things like this. But again, these are procedures which need to be planned. These are procedures which are never an emergency. So, I mean, it's very easy to understand. I have varicose veins, which are there for the last few months or the last few years, or even sometimes for a few decades. And today I see something on the TV or hear something on YouTube or a radio talk show or on Google, and I see, oh, I have varicose veins. And you go to the doctor and doctor says, get laser done as soon as possible.
A doctor says, you mean?
Suppose the doctor tells you, get laser done as soon as possible. Otherwise, this can happen, that can happen. I mean, how can you even believe that? Something which is with you for so many days or decades, how can they become an emergency suddenly?
Correct.
So patients, I think, need to be sensible when they seek advice that chronic problems don't require emergency treatment. Emergency problems require emergency treatment.
Right. Understandable. Absolutely understandable.
So the reason I'm mentioning this so strongly is because across the globe, there is a lot of unnecessary varicose vein surgery being done for patients who do not actually require surgery. I would say even 70 to 80% of surgeries may be unnecessary in sometimes.
70 to 80%?
May be unnecessary. I see 4 or 5 patients every day whom I advise, who have been advised laser surgery ASAP. And I tell them, your veins are perfectly fine, you do not need surgery.
At least 4 patients every day?
4 or 5 patients every day whom I have to convince that their legs are fine, their veins are fine, they don't need surgery. So that is why I think it is something that hurts me a lot, that so many unnecessary procedures are being done.
Absolutely. I mean, this actually devastates my heart right now, because second opinion is always the best. That's
Absolutely.
What people, yeah.
Take a second opinion, never rush in. Take your time to plan, to decide. If you think you have varicose veins because you have seen something on the TV, forget it. I mean, so far if it was not bothering you, why should you suddenly get bothered now?
Correct, absolutely. Because you've been living with it for a long time, right? So it has become a regular stuff for you.
Yeah. So if it is causing some discomfort, it is causing some pigmentation, causing ulcer, definitely yes, seek advice. You see something that is visible, it bothers you, seek advice. But don't rush into procedures.